And welcome back. Let's ask you about cannabis and young people. Our investigative team has been reporting on the professionals who work with young people, and they're sounding the alarm about this high potency cannabis. Now, it's sending young people into addiction, depression, anxiety, even psychosis. Where is the state on educating kids and parents as well on high potency THC? It appears to be causing a lot of problems right now.
I think we've made a lot of progress with cannabis use, in particular in youth and adolescents. If we look back in 2019, right before the pandemic started, we had record high levels of youth in Massachusetts using cannabis. About 30% of high schoolers said that they were using. Within 2 years, we dropped that by nearly 50% to just over 15%.
How did you do that?
A lot of that was work by the Department of Public Health in collaboration with the Department of Mental Health, with schools, with community-based organizations to talk about behavioral health promotion, right? How do we be healthy in our behavioral health? And also to talk about the risks of cannabis use, the risks of anxiety, of decreased attention, difficulty concentrating in school, and providing that education to young people and to families. We still have work to do, right? We want to see everyone be healthy in schools and all of our young folks to be healthy. But I'm actually glad that we were able to bring in this intervention and drop those rates.
So not enough has been done, right? You can always do more.
We can always do more. We can always do more, yeah.
The next topic I'm going to talk about, I'm actually surprised, almost 2026, we're talking about measles. But measles outbreaks are growing in several states in the union, and that includes Texas and South Carolina. Nationally, the measles case count is nearly 2,000, which may sound minuscule in a country of, 339 billion. But this is a disease that has been considered eliminated in the U.S. since 2000. Cases have mostly spread among people who are unvaccinated. So how would you grade the state and then the federal response to those outbreaks?
Well, if I can start with the federal response, I'd give them an F in their response to measles. And that's with all due respect to colleagues of mine who were at CDC for a long time. I'm speaking specifically about Health and Human Services and RFK Jr. and his leadership. He wasn't even willing to state that the vaccine was beneficial. He didn't want to promote vaccination in communities where measles was spreading. But if we turn to the state, here in Massachusetts, I think we've done a lot to educate folks about measles and the importance of vaccination. We've done a really good job at getting people vaccinated. Statewide, over 96% of kids in kindergarten are fully vaccinated with the measles, mumps, rubella vaccine. That's pretty impressive.
This was supposed to be eradicated in this country.
It was supposed to be eliminated, and I think we're really on the verge of losing that elimination status because of these outbreaks that seem to be linked between Texas, New Mexico, and what's happening in South Carolina. The sad thing here is that it's so easy to maintain elimination status simply by getting folks vaccinated.
And is elimination status 0? Is that what it is? I mean, 2,000 sounds like a relatively small number.
It does. So elimination status has to do with the number of outbreaks that happen in a particular country in a given year, and if those outbreaks are all linked. Every year we have cases of measles in the United States, usually from people who are traveling overseas and come back to the United States. But in this particular year, we saw cases start in West Texas and then start to spread to other states in the country, and they're all linked. And the link between them all is unvaccinated communities.
All right, Dr. Goldstein, thank you so much for joining us this morning.
Thank you for having me.
It's great to have you on the record. The last on the record, by the way, for 2025.
Happy New Year.
Happy New Year.
Happy New Year.
Thanks for coming in. The roundtable is next. Stay with us.